I'm Professor Emily Mercury, and this is Chapter 13, Autonomic Nervous System Drugs in Essentials of Pharmacology for Health Professions, 9th edition. Chapter Objectives. Upon completion of this chapter, the learner should be able to describe the sympathetic and parasympathetic nervous systems, contrast the 4 categories of autonomic nervous system medications, list the most frequently used key medications in each of the 4 categories and the purpose of their administration, describe the possible side effects of each of the key medications, relate patient education concepts that pertain to the 4 categories of autonomic nervous system medications. So when we're talking about the autonomic nervous system, I think automatic. So it is a self-governing system. It's involuntary. So you are not controlling what it does. It happens automatically. And the autonomic nervous system is divided into the sympathetic and the parasympathetic nervous systems. There's a diagram here. It shows the brain and the spinal cord are your central nervous system. And then your peripheral nervous system is the nerves that come out from the spinal cord and innervate the rest of your body. The autonomic nervous system can further be broken down into the sympathetic and parasympathetic nervous systems. The sympathetic nervous system is your alert system that quickly prepares your body to face emergencies. It automatically alerts to cause physiological responses to prepare you for fight or flight. So when we talk about fight or flight, we are talking about a threat, whether real or perceived, that is causing your nervous system to kind of kick into overdrive and say, I either need to fight my way out of the situation or I need to run, right? And so these are high stress responses. And historically, I think of, predator, prey, these kind of hunter-gatherer societies, right? Actually, the threat could literally be fight or flight. Not to say that there aren't situations like that today, but oftentimes our perceived threats to our sympathetic nervous system are not true life or death matters, right, in today's society, but the responses remain all the same. So these responses can include pupil dilation, which helps to let in more light, helps to improve vision, inhibits salivation, relaxes bronchi, which allows you to take in more air, increased heart rate to send more blood flow to the muscles, slows digestion and reduces intestinal muscle motility. So that goes with the inhibit salivation. Essentially, you're not needing those systems, right? Your digestive system is not important when you're thinking, I need to have a fight or flight response. So the blood flow and all of the reserves of your body are kind of going to the musculoskeletal system, the brain, sharpening your senses. And so everything's going to kind of slow on the digestion tract side. Adrenaline is produced, which, again, adrenaline in of itself is speeding up your heart rate. It's making your body ready to primed to kind of do this high intensity thing, which is the fight or flight. And then reduces reproductive blood flow because you are, again, not needing those organs at this time. That's not something that's going to be a priority. So there's less blood flow within the reproductive tract. The parasympathetic nervous system, on the other hand, can be thought of as the body's rest and digest system, which helps to maintain the normal body functions without any conscious effort. Chemical substances called neurotransmitters are released at the nerve endings within these systems to transmit nerve impulses from nerve to nerve at the synapses, or from nerve to smooth muscle, cardiac muscle, or glands. The following are parasympathetic reactions. Well, again, they're still automatic. They're under the autonomic nervous system, but these are the things that are happening when your body's in more of a resting state. Pupil constriction, you don't need that high level of vision and light intake. Stimulated saliva, bronchiconstriction, slow heart rate, stimulates production of bile and stimulates digestion. The same as with the saliva, that's all helping you to digest your food. Intestinal muscle motility increases, and increased blood flow in the reproductive tract. Why do we add the reproductive tract? They want you to know, and it's here under this picture, that the parasympathetic nervous system is what would cause an erection if you were obviously stimulated or aroused. That's part of the parasympathetic nervous system, not part of the sympathetic nervous system. And why that matters is because there are drugs that we're going to talk about later in the chapter and later on in the content that can cause prolonged erections or can actually cause issues with priapism, which is a prolonged erection that can cause damage and ultimately cause ischemia to the penis. So this is something that they want you to be aware of specifically for the parasympathetic nervous system. Knowledge check, which is not a sympathetic nervous system reaction. A, constricted pupils. B, increased heartbeat. C, relaxed bronchi. D, reduced blood flow. Remember, sympathetic nervous system is our fight or flight. And the answer is A, constricted pupils, because in the fight or flight sympathetic nervous system reaction, it would be dilated pupils. There are 4 categories of autonomic nervous system medications, and these are based on whether they mimic or block the response of the sympathetic or parasympathetic nervous system. These include adrenergic, which are sympathomimetic, meaning they mimic sympathetic responses. Think adrenergic, remember that adrenaline is released during the sympathetic nervous system response, and so if that helps you to remember adrenergic adrenaline. Adrenergic blockers, sympatholytics, block sympathetic responses. Cholinergics, parasympathomimetics, they mimic the parasympathetic responses. And then cholinergic blockers, parasympatholytic, block the parasympathetic responses. Knowledge check. Which category of the autonomic nervous system blocks sympathetic responses? A, cholinergic blocker. B, adrenergic blocker. C, cholinergics. D, adrenergics. So remember, sympathetic responses, fight or flight, release adrenaline. So we want to look at the adrenergic, and then it's asking which one blocks those responses. So your answer is B, adrenergic blocker. Adrenergic receptor medications. The table below shows 4 various adrenergic receptor medications, their uses, side effects, and contraindications. Medication name epinephrine. Medication use for bronchospasm, asthma, and cardiac arrest. So remember, adrenergic medications or sympathetic mirror the sympathetic response. So one of the responses is to relax the airways, right? So epinephrine given intramuscularly for an allergic reaction helps control bronchospasms and reduce the swelling in the airway. When it's inhaled via racemic epinephrine for an asthma attack, same thing, it's going to help relax the airway. In cardiac arrest, we are giving it directly into an intravenous line or an intraosseous line, and that is going to stimulate the heart to contract, to beat. So it's important to know that the form that we give epinephrine in, it will have some of the same side effects, but it's going to be a different concentration and it's going to be a different route depending on what we're trying to treat. Side effects of epinephrine, cardiac side effects associated with increased heart rate and blood pressure, nervousness or tremor, and hyperglycemia. If you've ever had an allergic reaction and had to have like a severe allergic reaction, had to have epinephrine, people are always really jittery after. Their heart rate's a little fast because it's kind of kicking up that whole response system. Medication named dopamine, medication used to raise blood pressure, cardiotonic. So if someone has a really low blood pressure or we need to increase the strength of their heartbeat, we will use dopamine. Sometimes there's different medications, but sometimes dopamine is our first line depending on what all is going on. And the cardiac side effects associated with increased heart rate and blood pressure, nervousness or tremor, and hyperglycemia are going to be the same side effects. It's actually going to be the same for all 4 of these because, again, they are kicking up that sympathetic response. So your side effects are going to be the bad effect of that sympathetic response and what that looks like. Isoproterenol for heart block or ventricular arrhythmias. Again, same side effects. This is going to be one that we will choose for specific heart blocks or arrhythmias versus just needing to increase the strength of the heartbeat. Norepinephrine for acute hypotension and severe shock. Norepinephrine is one that we give a lot when someone's blood pressure is very low. And what it does is it kind of clamps down the blood vessels to increase the blood pressure. But unfortunately, peripherally, you lose some blood flow when you're using something like this, because we are trying to get adequate blood flow to the core and to the brain and to all of the most important organs. Adrenergic blocker medications. The table below shows the various adrenergic blocker medications, their uses, side effects, and contraindications. Adrenergic blockers work against the sympathetic response. Again, this is not an all-inclusive list, but these are a few of the more common ones. Propranolol, which is a beta blocker. Propranolol is used for blood pressure control. It's to get high blood pressure under control. Angina, which is chest pain. Arrhythmias, and migraine prevention. Side effects of the medication are hypotension, bradycardia, fatigue or lethargy, bronchospasms, nausea and vomiting, hypoglycemia, and confusion. So I want you to think somebody has high blood pressure. There's a lot of resistance in their vessels. It's going to help to block that response, which is going to clamp everything down to increase the blood flow. It's going to relax those blood vessels, but then that can cause the blood pressure to drop too low. It's kind of what it's saying here with these side effects. It can also cause the heart rate to drop too low because it's blocking that response where we're clamping down the blood vessels and making the heart beat faster. Another major medication under this category is metoprolol tartrate, which is also a beta blocker. If you see the olol at the end of a medication, it's in the beta blocker category. The medication used for metoprolol is to treat hypertension, which is high blood pressure. These side effects are going to be the same as they are for the propranolol. Adrenergic blocker medications, slide 2, metoprolol succinate, which is a beta blocker. Again, it's just a different form of metoprolol. It also treats hypertension, and the side effects will be the same. Doxazocin, which is an alpha blocker. Doxazocin is used for hypertension and also for benign prostatic hyperplasia, which is where the prostate grows large and can be difficult to urinate around the prostate. Has the same side effects as well. And then tamsulosin, which is again used for that benign prostatic hyperplasia. And this can help to increase blood flow because, again, we talked about in the adrenergic slides that you are reducing blood flow to the genitals during this fight or flight response, sympathetic response. And so the tamsulosin is going to help to block that effect so that there's increased blood flow and easier for urine to flow past that enlarged prostate. Cholinergic medications. The table below shows various cholinergic medications, their uses, side effects, and contraindications. Cholinergics stimulate or mimic the parasympathetic nervous system. The first one here is bethanechol. This is used for postpartum or postoperative urinary retention, not used for BPH like the others we spoke about in the earlier slide, but this is going to help increase the blood flow and allow for passage of urine for people with urinary retention. Side effects for all of these cholinergics are nausea, vomiting, diarrhea, muscle cramps and weakness, slowing of the heart, hypotension, sweating, excessive salivation, lacrimation, which is discharge of tears, flushing, respiratory depression, and bronchospasm. The next medication here is cevimeline, used for xerostomia, which is very dry mouth. So again, increasing that salivation is going to help to reduce the symptoms of dry mouth. Cholinergic medications, slide 2. Medication name neostigmine. Medication is used to lower intraocular pressure in glaucoma. Glaucoma is a disease where there is increased pressure within the eye, and it can lead to blindness if not treated quickly. So this is an important one to be aware of, that that's a disease that can happen, and a lot of times happens in people with high blood pressure and or diabetes. Medication pilocarpine is for the treatment of xerostomia, which again is that dry mouth. And then medication pyridostigmine. This is primarily for the treatment of myasthenia gravis. Myasthenia gravis is a autoimmune disorder, and it leads to rapid muscle weakness, and it can be very dangerous because it can lead to weakness even not just in skeletal muscles, but in muscles required to breathe, muscles required to move the diaphragm and intake more oxygen. So myasthenia gravis is a very debilitating disease. And the reason that we give a cholinergic in this case is because it increases the amount of acetylcholine at the neuromuscular junction. And that helps to counteract the body's antibodies, which in the case of myasthenia gravis are inappropriately blocking the acetylcholine receptors. So I don't expect you to remember all of that, but it's just another medication to be aware of that is under the category of these cholinergics, which again mimic the parasympathetic response. Cholinergic blocker medications. The table below shows various cholinergic blocker or anticholinergic medications, their uses, side effects, and contraindications. Cholinergic blockers are drugs that block the action of the parasympathetic nervous system. The first one here is atropine, and it says on the table that it is used preoperatively for bradycardia, but it can be used for bradycardia at any time if it is a symptomatic bradycardia, a new bradycardia, and there's no contraindication. So what bradycardia is an abnormally slow heart rate. And what I mean by symptomatic is if somebody comes into the hospital and they say that they've been really dizzy, short of breath, lightheaded, they're having symptoms from that bradycardia, atropine would be a first-line drug to help treat that, to help increase the heart rate. Side effects of all of your cholinergic blockers are fever or flushing, blurred vision and headache, dry mouth, constipation and urinary retention, falls, delirium, and cognitive impairment, especially in older adults, and palpitations and tachycardia, which is an abnormally fast heartbeat. The next medication is scopolamine. Scopolamine helps to prevent motion sickness and reduces salivary flow. It's usually used in like a patch. It goes behind the ear, and it helps to reduce that salivary flow and thus kind of help with nausea as well. And it's also used oftentimes in patients who are passing away actively because they tend to have a lot of secretions towards the end of life that can be uncomfortable for them to manage. And so that's an option for that as well as for motion sickness. The next medication here is homatropine, and this is mydriatic. And what that means is that it dilates the pupils, and this is given in ophthalmology when they're doing eye exams and they need to, test the eye. Cholinergic blocker medication, slide 2. Medication name dicyclamine, used for irritable bowel syndrome. So irritable bowel syndrome, a person's often having intense cramping, diarrhea, so this can help to slow things down and slow down that motility. Fesitaridine is used for overactive bladder and bladder spasms. And oxybutynin is also used for overactive bladder. Knowledge check. Which represents a commonly used adrenergic beta blocker medication? A. Doxazosin. B. Metoprolol tartrate. C. Pilocarpine. D. Dicyclamine. Adrenergic beta blocker. Remember, if it ends in olol, you are looking at a beta blocker. So the answer is B. Metoprolol tartrate. Case study activity. An adult male attending a baseball game suddenly felt a sting on his left arm and realized he was stung by a wasp. He has a severe allergy to bee stings and instantly began noticing difficulty breathing and closing of his airway. Which medication would be the first line of treatment? A. Epinephrine. B. Metoprolol tartrate. C. Doxazosin. D. pilocarpine? And the answer is A, epinephrine. In this case, we're looking at an EpiPen, which is giving intramuscularly to help open that airway up. Knowledge check. Which is not a possible side effect when using the cholinergic blocker atropine? Remember, atropine is something we will give for slow heart rate. So not a possible side effect, A, blurred vision, B, abnormally fast heartbeat, C, dry mouth, D, muscle cramps. And the answer is D, muscle cramps. Patient education for autonomic nervous system medications. So again, in general, if you're looking at medications within these categories, they're all going to have similar side effects. Under adrenergic receptors, this one is specifically focusing on epinephrine because the other ones that we talked about aren't ones that you would be carrying around with you. They're ones that would be given in a hospital setting. So for the adrenergic receptor patient education, we're going to talk about the EpiPen. So with an EpiPen, we always need to keep the medication with us. Learn in advance how to properly inject the medication into the thigh. So if you know that you have an allergy that's severe enough to warrant being prescribed an EpiPen, you need to have that medication with you at all times. In terms of properly injecting it into the thigh, we say blue to the sky, orange to the thigh. And so there is a blue cap on one side and orange on the other. The orange pushes down against the leg, and you are going to click the blue until the needle goes into the thigh. A family member also needs to know how to administer if you are unable to administer, so maybe the person passes out. Seek immediate medical attention after the injection because the effects are not long lasting. So epinephrine has a short half-life. They're going to need additional medical attention and monitoring, possibly even another dose. And then recognition of when a second dose may be necessary if that airway starts to swell again. For your adrenergic blockers, we want to rise slowly from a reclining position to avoid postural hypotension. So if somebody takes an adrenergic blocker, remember it can lower their blood pressure, lower their heart rate. And so if they sit up really suddenly and they are not used to having their blood pressure, heart rate lowered, that can cause them to faint or become lightheaded. And it causes a sudden drop in blood pressure. Report possible slow heartbeat and dizziness, difficulty breathing, or excessive weakness. If you have diabetes, check with healthcare professional before changing your diet or the dose of your medication. Avoid alcohol and histamines, muscle relaxants, tranquilizers, and sedatives because this can lead to central nervous system depression and sedation when given in combination with an adrenergic blocker. Report sexual dysfunction or depression to your physician. Do not discontinue medication abruptly except on the advice of your physician. And then consult a physician or pharmacist before using over-the-counter cold medications because these can interfere or cause kind of a stacking effect when used with adrenergic blockers. Patient education for your cholinergic medications. Immediately report to a physician or an emergency department any symptoms of prolonged gastrointestinal distress, excessive perspiration, slow heartbeat, or depressed respirations. And avoid any combination of cholinergic medications with heart medications or cholinergic blockers. Remember, we're giving cholinergics to mimic the parasympathetic response, and so we don't want to give them with something that's going to cancel them out or cause competition within the body between the two medications. For your cholinergic blockers, report fast heartbeat or palpitation, feeling faint or falls or trouble passing urine. Report blurred vision or dried secretions, and avoid oral anticholinergics with chronic obstructive lung disease and asthma, and use inhalants only as prescribed, never using over-the-counter inhalants. Knowledge check. Which represents patient education you would provide to a patient using a cholinergic blocker medication? A, symptoms of prolonged gastrointestinal distress. B, recognition of when a second dose may be necessary. C, report fast heartbeat or palpitations. D, rise slowly from a reclining position to avoid postural hypotension. Again, a cholinergic blocker is going to block the parasympathetic response, and so that could lead to fast heartbeat or palpitations that will need to be reported. Answer is C. Self-assessment. What are the 4 categories of autonomic nervous system medications? What are the side effects associated with atropine, which is a cholinergic medication? Which nervous system is known as the body's rest and digest system? I also want to leave you with this fun little mnemonic. Take it for what you will. But something that I learned in nursing school was when we're trying to remember cholinergic and anticholinergic drugs, because cholinergic is the rest and digest, we will say you can see, you can pee, you can spit, you can shit. And anticholinergics can't see, can't pee, can't spit, can't shit. So it's silly and it's a curse word. I know, I apologize, but it always stuck in my mind a little easier because of that. And so with your anticholinergics, you're going to have the side effects of blurred vision. You might have urinary retention, you have dry mouth, and you have digest problems with constipation. So it's just something kind of fun. If that helps you, take it for what you will. Other than that, thanks for listening. This has been Chapter 13 of Essentials of Pharmacology for Health Professions, 9th edition.